do. You have to see, hear, do and say. So you have to use all your sense organs appropriately. That is why our master Dr. Hahnemann has said that the physician is one who is a good observer, who is a good patient's listener, observer, having a sound knowledge. So Dr. Hahnemann has incorporated, and mind it well, this is the science. You are very fortunate to have this science as a curriculum as a career for you, because this science which has been developed few centuries before, and still everything is applicable for today. There is no other science, all the science are going on developing because their base is not firm. If nature is not going to change, if the sunrise and sunset are not going to change, till this existence has been there on the earth, and that is the foundation of an homeopathy, where it has been based on nature's law, the principles of all nature. If they are not going to change, yet come the COVID or any other illness of any unnamed illness, still we are having a solution for it. It is not like first generation cephalosporin till the fourth generation cephalosporin. Every drug in the modern science keeps on changing. After few days, you will not find it out, that drug and its existence. So here there is something for you which is very unique, which is very important. Right? So that is why we have to understand that the science with which we are having, it is possible for you. If you do all these things, you will be a best learner. Best learner, I will say, best learner. Now again, what you can see? A triangle having at one end trainer, learner and learning content. Interesting. In any training setup, the trainer, the learner and the learning are the three elements which interact. Do you all agree?
Yes.
Yeah, like here on this situation, I am a trainer, you are a learner, and this PPT is the content. Are you getting my point?
Yes.
So the question comes. Which side of the triangle is the most important one and why? Interesting. We will give everyone chance. If no one will be there, you will be there. No problem. Yeah, somebody who has not spoke can raise a hand.
All sides are important because it is a mixture of everything. Means everything helps in our success. So if one side is weak, then the other two sides cannot help us in our success.
Very good. So she feels that all sides are important. Great. Anything else?
They are all interrelated.
They are all interrelated. Nice one. Good. Anything else?
One side cannot exist without the other.
One side cannot exist without the other. Like you said that the COVID-19 and self-learning, trainer was not there. Only learner and content was there. Still you learned. I approve. So whatever you are saying, that all the things are, you are at very high level. Are you getting my point? Like one chapter in biology, for example, a plant biology or cell biology, and you are not there in the whole class for that whole lectures which has been going on in the 12th. Still, you took some notes from your friends. You learnt on your own and you understood and you moved ahead. Trainer was not there. Learner is more important. Learning is more important. Content is more important. Okay, great. सर अगर बुक ही नहीं रहे तो है ना गूगल बाबू, बस कुछ भी डाल तो मिल जाएगा आंसर. कोई बुक की भी जरूरत नहीं आजकल की लर्निंग.
Sir, a good trainer is a good learner, right? So
Good.
even if we do self-study, we are training ourselves. So first we have to develop those training abilities, like we teach others. In the same way, we are training ourselves. So we are playing the role of both trainer and learner at the
Okay,
same
we
time.
are playing the role of learner as well as trainer.
We are
And
simplifying the language of book, right, for ourselves.
yeah.
So we are training towards.
Very good. So, a content you are trying to understand and you are trying to, very important thing what he shared is to train others. You are becoming a trainer. So, I hope you all rightly said everything. Okay? So, the real thing is, there is something, I myself will be a trainer also and learner also. When I want you to teach this, first thing what I have to do is to learn. And then only I want to make a content and give it to you. Is it something which has been taught by my teachers to me so that I can deliver it to you? No. Copy paste. So most of the time you will find it out that the situations are there where we have to change our role. At one time we may be a learner, but at another time, अरे मी एवढा सुंदर नोट्स बनवला आहे ना का बस पाहिजे तर माझ्या नोट्स घे. मी कशाला देऊ माझ्या नोट्स एवढ्या कष्टाने बनवलेल्या रेडीमेड. There are attitudes which have been there, you will find it out. But you are making content. And then, चल मी तुला सांगतो, एकदम सोपा चॅप्टर आहे हा, चल. You are a trainer. So now you are changing your role. And I hope if you are having such a kind of a combination, actually which is the best is this center. This is the best thing, and all three components, you all rightly say that all three components are essential. But how you look it out into all these three components will become very important, and ideal learning happens at the meeting point of these three. So if you are giving your notes to your roommate, you are teaching them, you are trying to make them to understand, you will be a lifelong learner. And you will going to have a clear-cut understanding of that topic, mind it. So, sharing is caring, mind it. Give. दिल्याने कधीच संपत नाही. Okay? Give. Always, whatever notes, whatever things, whatever innovation you want to make it, give it to others. Share it with all of you. And you will find it out, yes. They will all going to, hey, असं नाही, तू चुकीचं केलंय, असं कर. You may also realize that there are certain things which are proper, which you can able to, एवढं easy येते learn करायचं. तू एवढं कशाला लिहिलंय, असं कर, learn. Mnemonics, for example, right? Which you must have applied when you have been doing the NEET study. With all these kind of things. So you are having all these things which are not been written in your books, but your creativity is there. You are trying to do all these things. Okay, so now we'll come to what is adult. When we define adult now, learning and principles. What is adult is biological or legal or social or psychological. All these terms will talk about the adults in a different way. So if I have to think about a legal issues, right? So from date of birth to date of birth, if these things are applied to 18 plus, we are adult. अच्छा 5 दिवस बाकी आहे का? नाही, मग तुमचं ड्रायव्हिंग लायसन्स नाही काढता येणार बरं का. So here my definition is very stringent, strict, correct when I apply to a legal field. When I talk about a psychological, अरे यार 12व्या वर्षीच त्याचं एवढं चांगली बुद्धी आहे. अ स्मॉल चाइल्ड, सर हा मुलगा आहे का काय, एकदम मॅच्युअर्ड माणसासारखा वागतो. Have you heard about such comments? Yeah. A small kid is having such a kind of a knowledge and behavior that he behaves like an adult. Yesterday one child came, he was shouting like anything in the waiting room, and when he came, the age was 2-year-old. When he came, he sat independently on chair and like this. And was just observing. I thought the same child was there or a different child was there. When he was behaving outside, he was different. He was really a child. And when he's been coming, he's having a professional norms and etiquettes that when he is in front of a doctor, like this, I was surprised. So what I could able to observe is this child is adult for me when he is attaining that kind. So my psychological understanding changes. My definition changes. A legal changes. A social changes. A biological changes. A person attained and maturity but having no secondary sexual characteristics, for example. So biological reference levels are there, legal are there, psychological. So they all talk about an adult as a very different phenomenon, different thing. Okay, so no single definition is consistently used to identify the adult learners. But this Malcolm novels says adult is one. We become adult psychologically when we arrive at a self-concept of being responsible for our own lives, of being self-directing. This is the most important definition which should apply for this session or for overall your study. So here we are talking about who is adult. An adult who is a person who is psychologically having derived a self-concept. Now there is a big book which has been written by Elizabeth Hurlock. She is talking about a self-concept. It's so much big book, having maybe more than 500 to 800 pages. Self-concept. Okay, so now we have to understand these things. So what is self-concept? Okay, and what is, we are responsible for our own lives. तूच आहे तुझ्या जीवनाचा शिल्पकार. There are many theories in the market which you will find it out. They try and apply the same thing. You are responsible for all your own needs. किती मार्क मिळाले नीटसाठी? काय ते मी कोणत्या सेंटरला माझी परीक्षा आली होती तिथे मला 2 मिनिट उशिरा दिलं, 5 मिनिट लिहून नाही दिलं, मला रफ रायटिंग करून नाही दिलं. You are making them responsible, but in reality telling, you yourself are responsible. Mind it well. Okay? So here we are talking about we are responsible and of being self-directing. So now onwards, whatever direction you want to achieve in your life should be decided by you. Because now you are adult. You are having individual thinking abilities. Now you can sign on a consent form. Right? Why? Because now we call yourself as a matured person. Now you know what is right and what is wrong for you. When you yourself can know that what this is right or this is wrong for you, then yes, you are certainly. So mind it well, again SDL, self-directed learning. That is why we have been calling about this. Okay, so now this is adult. Now coming to learning. Now what is learning? It is a permanent change in the human capabilities that is not a result of a growth process. See, this is learning. Because when you get your age advances, you start growing. Right? Growing with maybe the length of the height, the weight, and the body characteristics. But it is not a learning. It is only growth. Right? But when we call it as the permanent change in the human capabilities, as a child I could not able to grasp. Now I can able to grasp. And now I can able to lift. And now I can able to lift 100 kgs. May not be possible, but I am joking. But still, 80 kgs, no problem. But this is what we are talking about, that my capabilities are changing. Right? My capacities my capabilities, if they are lifelong changing, right? So then we call it as it is a learning. It is a learning. So Mr. Swami Vivekananda said that the learning is the permanent change in the behavior of a person. The learning will be possible only and only if something you are teaching and it which can make a permanent change in the pupil, in the person to whom you are teaching. That will be a good learning scenario. Right? So, adult learners are different. It is not like working with children. As a child, you must be knowing that our mother has to pull, has to shout, अरे बस ज़्यादा खेलना आता ये, थोड़ा सा तो अभ्यास कर. Right? Understand her expectations. So at that level, as a child, the learning scenario is different, and now there is no one who will tell you that you sit and you do and you learn. There may be a parent is parent, and we as a kid, we are always child for the parents. So a phone call will come, हाँ तू पोचली क्या कॉलेजमध्ये आज? हाँ आज काय झालं? आज काय शिकली? आणि आज काय करणार? आणि आज काय खाल्लं? आणि जेवली का? So you will understand that all these things are been going on because they are having a concern, a genuine concern that my child should not get deprived of at least a good knowledge, good environment, and a food and the health. That is what their mere expectations are. So we have to understand that we have to learn. We are here for learning. If our objectives are clear, no other objectives. There are many secondary objectives which are there, but you keep all aside. Your first objective and target should be, we are here because our parents with their efforts, we are here. Their objective is to make us a good doctor, we have to be a good doctor. Right? So we have to follow objectives which has been set, certainly, properly. Okay? So learning is a change in the behavior or cognitive process. So if your behavior has been changing, you have learned. You are a learner. You are a educationist, or you have done your education. By having a degree, say example, I am having a 10 degrees. But I will come and I will abuse like anything and I will throw like anything. I kakkal, asa basta ka? I have learned. But have I applied this? No. Then the thing is, it has to make a change in behavior of a person. In a behavior. If you are learning, you have to understand that your objective is to be a good physician. And you learn, you go through the literature, find it out, whichever physician which you like from the literature source, and find it out what qualities these personalities must be having. And we have to assume, we have to learn from that personalities. Right? So that is where we are talking about the change in the behavior. In training, it is a change in knowledge, skill or attitude. Now we are talking about a medical training. Here we want to train. When you are learning, you should know that you are having a change in your knowledge. खूप सर्दी झाली आहे, दही खाऊ नको, थंड असतं. Have you heard about such thing? Yes. अच्छा, प्रेग्नन्सी झाली आहे, डिलिव्हरी झाली आहे, 3रा दिवस आणि तू बेडच्या खाली उतरली. रॉंग. बाळाला काय होईल? तू काय खाल्लं? अरे बाळाला त्रास होईल, कशाला खाल्लं? Have you heard about such things? Okay, so now we have to change in our how far these are the things which have been going on around us. अच्छा, लहान बाळ आलं, एक काजळला, त्याला डोळ्यात तेल टाक, कानात तेल टाक, अजून काय काय कर. Knowledge. And the patient has been coming and asking you, sir, हा असा आहे, ह्याला काजळ लावली तर चालेल? Now they are asking what? They are testing what? They are testing your knowledge. Because they are having their own knowledge. You should have a proper knowledge. If this knowledge has been changed, you have learned efficiently in this institute. Are you getting my knowledge? Understanding? So the change in knowledge, change in skill. The skill, how you come, how you dress yourself, how you talk, how you interact, how you meet, how you greet. A teacher has been coming by and you are not wishing. The teacher may not feel anything, but you should feel. So these are the things which will going to make you be as a good human being with certain values. So our institute is not here only to make you a doctor, but to make you a better citizen of India. Again, you have to give something to your society. Again, you should have a value inside you. A doctor without value and a doctor with value make a lot of difference. Mind it well. A doctor without value system and a doctor with good value system are extremely different things in other medical professions. So we want to have a knowledge, we want to have a skill, like suturing is a skill. Putting a catheter is a skill. Putting an IV and giving injection is a skill. Even though you are in homeopathy, these skills are there as a medical profession. Don't assume that homeopathy hai to ye sab kuch nahi. I am teaching you surgery. Oh, great. So it is a skill, full of skill. Without skill, we are nowhere. Are you getting my point? So here we have to change our skill and our attitude towards patient, towards friend, towards teacher, towards anyone who we are going to meet, towards our family member. If you are here and you are having one kind of an attitude, biased attitude towards your family member, and after learning this with this environment, you are changing that attitude, we have been proved that yes, we are good enough to change your attitude. Are you getting my point? So this is what an adult learning principle is actually. Now coming to the word, you might have heard about the pedagogy. Now here we are talking about andragogy. Now what is the difference between these two slides? Can somebody tell? Excellent difference. What is pedagogy? What is pediatrics? Yeah, I am a pediatrician. It means I am a doctor for the small children, kids. Now pedagogy is teaching small children, whereas andragogy is teaching adults. That's all. Simple definition. So now what is the difference between these two figures? Can somebody tell? Yeah?
The child is reaching out to everyone differently, but in the case of andragogy, they are interconnected.
Okay, good.
It's a circle.
Excellent, good. Yeah, last one.
Sir, andragogy is more like community.
Okay, it is like a community. Very good. Yeah.
So in andragogy, they are learning from each other,
Excellent.
and in pedagogy, only one person is teaching.
Excellent. Yeah. Anything? Last. Yes, you can.
In pedagogy, child learns from the elders, and andragogy, person learns from the peers and similar age people.
Excellent. That is what is the meaning. Here it is unidirectional learning. Unidirection, एक direction है, सिर्फ एक direction. Here it is multi-directional learning. The directions are being changed. Are you getting my point? So this is the interesting thing what as an adult learner we have to adopt. Now we are not a child. That the teacher will come and they will teach and then they will perform or then they will do these things. No way. Because university has set your calendar ready. At this time your exams will be there, it will be there. Your portion has been finished or not finished. Does university will care? No. Does the NEET examination people will listen to you that due to COVID we have not gone through our classes regularly, so can you postpone? No. They have decided. So mind it well, now you are adult. And now the learning will start, and it should be from multiple direction, not a unidirectional learning. So, andragogy is the art and science of helping adults learn. Very important word. Helping. What is the beautiful word inside this whole definition is helping. Okay? And educating adults involves understanding adult learning principles. And you should know all these principles if we have to incorporate any learning. It may be BHMS or MBBS or BDS or BA or BSc, it doesn't matter. Mind it well. So all things will going to have applied in this. Okay, so now we'll talk about the adult learning theory. Now this is some psychologically based. Those who are having an interest in psychology should, because in first year is the psychology subject is there or not?
Organon.
Yeah, it's there. So I hope you must be knowing the name of the subjects. Is psychology there in medical profession? Sir, the BA psychology आहे, MA psychology आहे. Yeah? It's there, yeah, it's there. It has to be. Mind it well, now it is not a BA psychology, it is BSc psychology. And now the NEP has changed. It is not BA or BSc or BCom. Now they have all integrated. All these 10 subjects, you choose whatever you are going to have, you are a bachelor. You are having a bachelor degree. Very good. Interesting things which have been coming up, I will tell you. In forthcoming years, you will find it out a drastic change. You can take account also, you can take a maths also, and you can take a psychology also. And this is what an integrated teaching and learning methodology, what nowadays you are doing. So that is the reason you are having pharmacology also. You are having psychology also in your curriculum. You are having homeopathy also in your curriculum. Are you getting? Are you trying to understand the depth with which we are talking about nowadays? Okay, so the andragogy model is being based on adults have the need to know why they are learning. अगर मुझे ये पढ़ना है तो क्यों पढ़ना है? क्योंकि आजकल के एडल्ट भैया मंदिर में जा, भगवान तेरे को पास करेगा, जाते जा, माँ बोल रही है आई देव पास करत नसतो, जाऊ दे मला अभ्यास करू दे. This is today's adult. Do you all agree?
Yes.
Because you are knowing only one thing, that there is no supernatural power like anything. Whatever we can do, whatever we will do, we have to do and we have to get it. But it doesn't mean that you don't have to pray. Your mom may be saying it is a praying, but you say, का जाऊ मी? अरे बेटा तिथे गेल्यावर 2 मिनिटाचं ॲटलिस्ट मेडिटेशन होतं, सेल्फ टॉक होतो, सराउंडिंगचा इम्पॅक्ट होतो. येस, दिस रिझन यू वॉन्ट. What is the quality of an adult learner? They want to know why. Every time they will ask, why I should do like this, why not in this way? So this is what an adult learning. So they need to know why. Why? Adults need to be self-directed. Now when we call it as a teenage, मला पण निर्णय घेता येतो ना, माझी पण चॉईस आहे ना, मला विचारलं का? So they are now self-directed. They want their opinion also should be get valued. Okay? Adults bring more work-related experience into learning situation. Nowadays, this is important. You are having an experience and exposure of so many things because our world is now very short because it has got connected with the mobile phone. Right? It has become, you are knowing that in Turkestan, the earthquake has took place. Immediately, the next moment, when it has took place, in the next moment, you are going to know. This is how we are talking about. And then you are saying, Sir, tithla earthquake, ata ithe shikun kai fayda? Okay, with such a kind of an earthquake, what are the medical emergencies which can crop up? So as a medical student, I should know the earthquake also and what are the medical impact or the health related impact of an earthquake on any surrounding, because you may be going into a government posting after BHMS and then you have been called as an Ayush personnel to go from the government side to help these peoples, like what our Prime Minister has did. They have sent a task force, a huge task force as a help to the Turkestan to get rid of such kind of a situation.